So if you have done any sort of yoga before, you might be familiar with these movements, but these are really great to practice in pregnancy every day in late pregnancy. So if you want to, in the second trimester, there's probably no problem with that. But especially in your third trimester, 5 minutes a day, it would be really beneficial in order to encourage baby to not only be head down, but to be in that nice little OA position. So if you remember from our anatomy video, OA position is where baby is nice and tucked in and their smallest diameter of head is presenting in the pelvis. So cat-cow can help nudge baby in there and encourage baby to be head down if they were breech, and can encourage them to wiggle. So you're doing cat-cow, which I will show you in a second if you've never done it before, and it's just helping nestle baby's head into the pelvis and spin and get nestled into that nice position where the smallest diameter of head is the presenting part in the pelvis. So for cat-cow, you get on your hands and knees and you breathe in and you let your shoulders go up and your head hang, and you tuck your pelvis in and you breathe in and you feel the skin on your back stretch. And then you exhale, you lift your head, you drop your belly, you raise your hips, and you breathe in and you tuck in your belly button up towards your spine. And then you exhale and you repeat those movements with your breath. And it's very recommended to do that 5 minutes a day in late pregnancy. So that is a really great preventative to have baby be head down and to be in OA position. And even though having breech babies and OP babies are variations of normal, they can come with additional complications. So any preventatives that you can do to encourage baby to be head down are really a good thing, especially if you don't have a care provider available in your area who specializes in vaginal breech births. So that is really something to consider. For example, in the area that I live in, we don't have that option. And so a breech delivery is considered the higher risk delivery. And so it's viewed as out of scope for our registered midwives. And so some obstetricians aren't comfortable with doing a vaginal delivery for a breech, and they would say that you would need to have a C-section. Other people have care providers in their area who specialize in breech delivery, so that's something that you can look into. But other ways of turning breech babies include different positions. So you can check out the Spinning Babies website, and they have different series of positions that you can follow for certain amounts of times to encourage baby to turn. And you can also look into a care provider who is trained in spinning babies. So that could be a midwife or a nurse or a doula who has been trained by spinning babies, who can assist you with different techniques and movements to help encourage baby to turn. And other things you can do are see a chiropractor in late pregnancy. So if baby is breech at the beginning of your last month, because a lot of babies are breech and then they end up flipping head down. So a lot of breech babies will flip head down on their own. But if you're getting closer to the time of delivery and baby is still breech, then you might want to implement some other measures in order to encourage baby to turn. So talk to your care provider about that if baby is still breech and you are getting into your last month of pregnancy. So if you go to see a chiropractor, they will do some little adjustments in your hips so that your hips are at the optimal position for birth. So we have hormones, relaxin and progesterone during pregnancy that are causing the joints in your hips to be fluid and movable so that your pelvis can actually open and change shape in order to allow baby to pass through. but you have these hormones during pregnancy as well, and your abdomen is getting heavier and putting more pressure on the hips, and they can actually change shape into a position that isn't the most optimal for birth. And so if you go to see a chiropractor, they can use the Webster's technique, which is specific for making adjustments in the pelvis so that your pelvic opening is the widest and most optimal for birth. And that maneuver alone can be enough to create enough room for baby to move head down and encourage baby to be OA instead of OP. So that's another thing that you can try out. Another technique for turning a breech baby is through acupuncture and other Chinese medicines. So those are other resources that you can utilize if you want to talk to them about what they have to offer. And another thing is external cephalic versions. So that means you're going to see an obstetrician in order for them to try to manually turn baby while baby is in your abdomen. So they'll be turning baby and they'll be monitoring baby the whole time to see if baby is doing okay in terms of being moved, because sometimes babies are breech for a physiological reason, and it means that that's where they're happy, and they're not happy if you try to turn them. And it could have to do with the anatomy of where their umbilical cord is. So if they try to get moved, the baby might be like, hey, no, you need to stop that. And then the doctor is going to stop and leave baby where they are. And baby might be able to turn on their own, or they might just be happy being a breech baby. But if you are going to do an ECV with an obstetrician, then try to bring a funny person with you if possible. Because if you have somebody making you laugh while they are trying to turn baby, it can actually relax your body and it can make it easier for baby to move. And from what I have heard, this maneuver can be successful about half of the time. So something that you can consider if you have a breech baby that you are wanting to encourage to be head down instead. But cat-cow is a great preventative, and seeing a chiropractor for the Webster's technique is a great preventative as well.